Hi, this is Dr. Greg Oliver. Welcome again to Fat Doctor TV. Today we're going to talk about heart attacks. You know, as we get older, get in our 40s and 50s and 60s, that we all know somebody who's had a sudden heart attack. And in a lot of cases you say, wow, that's kind of weird. I mean, they were a few pounds overweight, but they seemed active and seemed to be doing well, and boy, they just had a heart attack and ended up in the intensive care unit, or in a third of the cases, they just dropped dead. So what is it that keeps people at high risk for heart disease? Well, we know there are a lot of factors, one including genetics. So if you have a strong family history of heart disease or cardiovascular disease or stroke, then you're at risk already for that. We know that if you're a man, you have a higher risk than women. In this country, 1 out of every 2 women have cardiovascular heart disease, most of which don't even know. They're walking around with blood vessel disease in their heart. And of course, it's in the heart. It's also in other organs of the body. 2 out of every 3 men in this country have heart disease, but don't even know it. Now, obviously, there are those patients and people who have chest pain when they exert themselves, or have known heart disease. They've already had a heart attack. They've had a stent placed. They've had bypass surgery. But here's the statistic. If you're overweight, you have a greater risk of heart disease. If you smoke, you have a greater risk of heart disease. If you eat foods that have high cholesterol in them, or you have high cholesterol, whether it's from what you eat or genetically, you have a higher risk of heart disease. If you're sedentary, if you work at a desk or at a computer terminal all day long, you have a higher risk of heart disease. So it's easy to see why 1 out of 2 women and 2 out of 3 men have heart disease, whether they know it or not. So it's important that you focus on this, because it is the greatest killer of individuals in our country. And so I know that I have patients and they are scared of cancer and focus on cancer, and certainly cancer prevention is important. Cancer diagnosis and cancer treatment is extremely important, but we sometimes forget about the greatest killer of all, and that's cardiovascular disease, hardening of the arteries, atherosclerosis, whatever you want to call it, but it's happening and it's at high volumes. So what are you going to do about it? Well, that's what we're talking about today. I don't want to scare you and give you doom and gloom, because it is manageable. And even if you have high risk, family history, things like that, you can make a huge difference in it. Number one, if you smoke, you got to stop. You cannot be healthy if you smoke. Now on Fat Doctor TV, we focus on weight management and eating properly and reaching a fit weight. But here's the bottom line. You can be lean, you can exercise, you can feel great, but if you smoke, you're not healthy. You never will be. So you've got to stop smoking. Number 2, if you are carrying those extra pounds, you got to get rid of them. Hey, I know personally it's not an easy thing. Though I've gotten rid of a lot of weight in my life, I'm always struggling on those last 20, 25 pounds. And you can look at the camera and say, yeah, doc, drop those extra 25 pounds. And it's something I work on a regular daily basis. It helps me when I talk to you, because it keeps me focused on that. But here's the important thing. If you're greater than 30 pounds overweight, if you're in the obesity range, which is basically at a BMI of 30, then you are at high risk for shortening your life or having heart disease. So it's very important that you get those pounds off. How do you do it? Well, you start eating more healthy. You start eating more fruits and vegetables. You start eating more lean proteins. You avoid high-fat foods. You avoid things that are high in calories or simple carbohydrates, such as sweets and candies and things like that. Does it mean you have to eliminate those from your life 100%? No, occasionally those treats are fine, but you've got to get away from eating those on a regular basis. So if you want to live longer, if you want to reduce the risk of cardiovascular disease, heart attack specifically, and even stroke, then getting to your lean body weight, eating healthier, eliminating cigarette smoking, and seeing your doctor about other preventive measures that can work. But what are some of those measures? Well, eating more fish. Or if you don't eat a lot of fish, or you live in a part of the country where fish is not plentiful or fresh, then omega-3 fatty acids fish oil is a great supplement. In many cases, and check with your healthcare provider, but taking an aspirin a day can be very helpful. Taking vitamin D daily can be very helpful. So all these things, and there are many, many more preventive ways to deal with of limiting the risk or reducing the risk of heart attack. So check with your healthcare provider and say, look, I'm concerned about my risk. I know that 2 out of 3 men and 1 out of 2 women have cardiovascular disease. Am I one of those people at risk? And what can we do to take care of that? So today we've been focusing on heart attack, but if you can get to your lean body weight and kind of take better care of yourself and exercise on a regular basis, then you should be able to avoid developing premature cardiovascular disease, heart attack, sudden death, stroke, and all those nasty things we just want to stay away from. So if you have any questions about this, give us a contact or reach us here at Fat Doctor TV. I look forward to talking to you next time. This is Dr. Greg Oliver saying so long for now. Have a great day.